Hello, everybody. It's Jamie from TTA. Melinda's on the line. Hello, Melinda.
Hey, everybody.
Hey there. It's a little bit early, so it's still 9:55. We have about 27 who have registered, and so I expect a lot more folks to log in the next few minutes. So thank you for joining us, Melinda.
Thank you for having me. I'm happy to be here and try to help shed light on how we can calculate our population-based reach strategies. It's definitely far more complicated than our individual-based strategies, but hopefully we have a few insights that are going to have folks having some aha moments for this.
Yeah, certainly. I'll remind everybody too, since our group will not be that large today, relatively speaking. Just raise your hand or send us a chat, and we will be happy to unmute your line so we can actually have a good conversation. We want to encourage that. So just send us a message, and we will make sure that you have a good audio connection to speak. Feel free to use the chat box or the question box too. We will monitor that as well. Melinda's slides we will post online today, and everybody will receive a really short survey too.
And I definitely do encourage you to ask questions as we go. We're going to try to walk through things step by step, but your questions are welcome throughout the process.
Anybody have any ice out there? I have about a quarter of an inch of ice and sleet, well, majority sleet here at home. Thankfully it's sleet and not ice.
Do we have anybody in the mountains on the call yet?
Not yet. It's a quiet group today, Melinda. Cold weather before the holiday.
Hopefully we'll have some good conversation after we get going, and most importantly, hopefully we'll resolve the questions that you have.
We certainly do encourage questions, so please just feel free to, you can start adding those now. But we know today's topic will be the Master Reach tool and some of the background behind that. And Melinda has a really good history in terms of requirements from SAMHSA that informed the design of the tool, and looking for methods of improvement as well, ways that we can make it be more user-friendly and so forth. So.
Yes, that's always a goal. So we do welcome your comments and suggestions, and we'll, see what we can do in terms of continuing to improve the tools and supports that we provide for you.
Okay, Melinda, let's give folks about 60 more seconds, and
Okay.
we'll try to get started to stay on schedule.
Sounds good.
And since we do have a small group, I'm going to activate everybody's audio. And if you could, on your end, attendees, mute yourselves, that would be great. And if we have accidental noise in the background that's consistent, I'll also I'll mute you on my end just in case if needed. But I would prefer, since it's a small group today, to keep the lines open, and you can feel free to maybe participate a tad bit easier. So I'm going to go through and unmute everybody right now. So if you could mute yourself, that will help dramatically. Okay, Melinda, just feel free to begin whenever you're ready, and we'll start the conversation.
Okay. Welcome, everybody. I'm glad you're here today to learn a little bit more about counting for population-based reach and how you can utilize the tools we've provided. I do welcome questions as we go, as well as suggestions to consider for ways that we can make this easier for you to do. As mentioned prior to the call time, this is definitely more complicated to do than counting individual programs, but I think we have a few things that are going to help get a better understanding of SAMHSA's rules and kind of how they apply. So with that, I'm going to go ahead, but again, feel free to interject throughout, either by voice or in the chat box.
Yeah, also, Melinda, before you started, there was some background noise that I couldn't tell where it was coming from, so I reverted back to a all mute status. So just send me a chat or raise your hand, and I'll be happy to unmute anyone who wants to participate. Thanks.
Okay, sounds good, Jamie. Thanks. So we have 4 things that we're going to do today. We're going to first define population-based strategies by SAMHSA's rules, talk about their counting rules. We're going to look at kind of the rationale behind their counting rules and see how they fit with things that we have a strong understanding of. And then we're going to actually go step by step through the population-based reach tool. First, I'm going to show you what the screens look like, and then I'm going to have us all kind of open a couple of screens and see if we can walk through one example. So with that, we're going to go ahead and proceed. You probably all have seen at different times this SAMHSA definition for population-based strategies, but it is the planned and deliberate goal-oriented practices, procedures, processes, or activities that have identifiable outcomes achieved with a sequence of steps subject to monitoring and modification. Those are exactly from the SAMHSA regulatory definition. It's kind of mushy, but then the examples that they provide align perfectly to information dissemination, community-based process, and then environmental strategies. So the information dissemination related activities are one-time single events, such as a health fair, schools assembly, any kind of materials that you might distribute. The community-based process activities are basically anything intended to impact a broad population, so all that kind of planning and collaborative work that you're doing in communities. And then environmental strategies is, as we know, establishing or changing written and unwritten community standards, codes, laws, norms, etc. And so by North Carolina's categories, that's communication campaigns and policy-related work. There's basically just 2 counting rules The first one is you should use the actual numbers if they're known, but you are allowed to use the census data or similar broad population counter if you don't know the actual numbers. So anything in communities you can use census numbers for. If you're doing something within schools that reaches the whole school, you can use the National Center for Education Statistics Common Core of Data and other sources that count the whole population. As with all other strategies, we can count each individual one time per year per intervention, but they may end up being captured more than once if they're exposed to more than one intervention. So we count individuals once per intervention, but potentially multiple times across interventions. Then SAMHSA provides several examples of how to count. These are from the original regulatory language, but as we see when we talk about things like a health fair, we can count the number of people attending. If we do a school assembly, we can count the full number of people attending. If we pass out any print materials, we can count the full number of people receiving those. When we do any type of radio or TV interview, like I know some communities have a regular spot on a radio talk shows, we can count the full listenership or viewership for that show. And anytime we distribute a PSA, we can count everybody who gets that. So if it's a newspaper PSA, you can provide it to the newspaper distribution. Same thing for radio or TV. So the bottom line is when we're talking about information dissemination, you can count everybody. You don't have to have just a portion of the population. It's literally everybody. And we do try to get demographic data for those populations. When we're counting community-based process, we're basically counting those people who are around the table. So when you're doing coalition building or just coalition work in general, you count the number in the coalition once per year again. When you're planning, managing, or coordinating any effort to affect positive community change, so again, your planning kind of time, your strategic planning, your needs assessment, all that, you count the number of people who are involved in the planning. So the bottom line in that regard is that when you're looking at community-based strategies, you count those people who are involved in the process. So everybody's sitting around the table. And then where the population-based reach estimator applies is for environmental strategies. When we have a communication campaign, SAMHSA's guidance is to count the number of people living in the community impacted by the training. Similarly, when you're doing policy work, you count the number impacted by the strategy. So again, the bottom line for environmental strategies, you're counting the impacted population. So who can guess what the impacted population means? Any thoughts about what that means to those of you on the line? We're going to look a little bit more at that. But for information dissemination, you should ask the organizers, the media, the school, whoever the group is, how many people they have and their demographics. Community-based process, you're going to know individually who's there in those planning groups. And again, for environmental strategies, it's those impacted. So impacted population. It's not necessarily the people that you're going to reach directly. It's very often going to be indirectly targeted, and it's the people in the group that you're trying to prevent substance abuse for. So, for example, in our underage tobacco use efforts for retail, we're looking to impact people who are 12 to 17 as the population most at risk for beginning tobacco use. But this always varies depending upon what your goals are and what the substance is. So anything for retail access, your ultimate target is underage youth. When you're trying to increase safe storage of medication, you're trying to impact those who actually have medications. When you're trying to impact prescriber behavior, you're trying to impact those who get an opioid prescription as kind of most at risk with inappropriate prescribing. Any questions? Okay. So the population-based reach strategy tool provides a mechanism to translate what the census gives us for numbers, which are really big numbers, and to put them into block grant reporting guidelines in the proportions that you're eligible to take them. We currently have worksheets related to retail access to tobacco and alcohol, safe medication storage, CSRS utilization, and safer prescriber training. If there are other things that you're doing that impact a whole population, please connect with the TTA Center, and we will work to help identify what the impacted population is and develop a worksheet for that. Right now, I'm not aware of anything that's happening that's not captured in those 4 worksheets we already have, but definitely if you are doing something in another area that's a population-based strategy, policy work, or another type of communication campaign, definitely let us know, and we will work with you to help figure out what the impacted population should be and add a worksheet to the REACH tool. Okay. So you guys are all going to get this slides, and again, I'm going to try to work through things with you step by step after we go through all the slides. So right now we're going to see pictures of what everything looks like at every step, including where to find the REACH tool. So it's on the TTA Center website, and this email address, this web address will be included in the PowerPoint for your use if you don't already have it downloaded. Once you're at the TTA website in the help desk, you can go to Counting REACH, which you can see pointed to here, Counting REACH, Population-Based Strategy REACH tool. The next step is you're going to go to the Census Fact Finder, and this email address is in the actual REACH tool, so you don't have to be able to find this webinar to be able to get that email address. It is directly in the REACH tool. When you open up that link, you'll see a screen that looks just like this with the United States Census, American Fact Finder, big magnifying glass. You'll see here a line that says county, city, zip code, and so forth, and this is where you enter your place. For most of our interventions, that's going to be a county for you, but it may be a smaller unit, like it might be a city, or zip code or something similar. Once you select that, you'll hit go, and then these numbers right here for the population will end up changing to the population for Forsyth County in this example. So this will change to whatever yours does, and once this number changes to your county population, then you're going to go down to the American Community Survey. This does update periodically, so it might not be 2016, it might be a later year when you next use it. But you're going to select on the demographic and housing estimates, because this is where we can get population by age, sex, race, households, and other units that are required by the block grant. In the American Community Survey, you're going to be able to confirm that it is capturing your county by looking at the top row of the data table, which will say your location. And when you go into the population-based strategy reach estimator, you also type in that same location. The next step within this is to look at the population by age. Very often there are age parameters around in the reach estimator, and so all the ages are always broken down like this in the census data. So it begins with under 5 and goes up to 85 and over. In the population-based reach estimator, you capture the age group that is shown in the age total pop lines that you're not going to care. And this example is for alcohol, underage alcohol sales. Only 2 lines of the census data is necessary, and it's the total population for ages 15 to 19 or 20 to 24. And so then you would enter those associated numbers. And you can see here in the census data, it's showing 15 to 19 as population as 25,558, and I've written that same total here. And similarly for the age 20 to 24 population, the census data is showing 24,720, and I've written that same number here. Some of you who are quick with your math will notice those numbers do not add up to this 16 to 20 estimate. And that's because this is taking, this estimate, the total, takes the 16 to 19-year-olds in this line, so it divides, it takes 80% of this total here, and then it takes just the 20 and the 21-year-olds from this 20 to 24-year-old, so it's going to be 40%. So you have just a fraction of each of these lines contributing to the estimator. You fortunately don't have to worry about the math for that. All the worksheets are set to determine that for you. But this number will also add up to what all your totals should end up looking like this in the block grant estimates. Within race, you'll see a header that says race. There's a whole bunch of categories in the American Community Survey that are not going to apply. I've put arrows next to the lines that you are going to draw data from. So you can see there is a line for 2 or more races, which in this case was 7,381 people, which is entered under more than one race. The American Community Surveys, actually, when I was pulling this together, I noticed they actually changed a couple of these titles. So we will likely make we'll change that to make it match again. All of the other categories do match. We have the white population, the Black and African American population, American Indian and Alaska Native, Asian, Native Hawaiian, and other Pacific Islander, and then some other race. These all coincide directly with what's available in the block grant. And so you enter these totals here. This number in the total line will be the whole population for the place you entered. So in our example, this is Forsyth County. So it's listing the population of Forsyth County. I'm pointing this out in particular because your next totals should all end up equaling the same number which you'll want to double check to make sure you don't have a data entry error. Next, you'll do similarly with ethnicity. So we only have to have 2 lines from the Hispanic or Latino and race categories, and they're Hispanic or Latino of any race. We don't need any breakdowns farther than that for block grant reporting. You, of course, if your community wanted further breakdowns, you could have those if they were relevant. The same thing with the additional breakdowns for race, but they're not needed for block grant reporting. So you also use the not Hispanic or Latino. Again, these numbers will add up to the total population of Forsyth County. And again, the Hispanic and Latino population was 45,145 via the American Community Survey, and we've entered the same thing. You can copy and paste them or type them in whichever way is more efficient. It's unfortunately not possible to just capture a whole row of the data in the American Community Survey and have it easily populate, since we don't need all the categories. How we doing? Okay.
Any questions out there or comments, folks? We can feel free to. We realize this is some quite technical information.
It is.
Sometimes it helps.
I'm gonna help us. I'm gonna ask everybody to open up some screens on their computer and walk through an example after we go through these to kind of see things that maybe we didn't realize while I was explaining them. Then we're going to do the same thing for sex. So we have at the very top of this American Community Survey, there's questions about sex and age. And so it has the male and the female population, which we've again replicated within the population-based reach estimator. And again, if you're have a good memory for numbers, you'll see that this total equals the same as the total for race and ethnicity. So again, when you're done looking, you'll want to confirm that these totals are all the same, and because that will tell you that you got your data entry correct. So those entries that are highlighted green, they are at the top half of the population-based reach estimator. We have the totals that are the block grant numbers below that with blue highlighting. And as you can see, I've obviously only provided one column worth of data places, but there's room to have up to 10. We do include the decimal point. You should not include the decimal point in your reporting, but we do it to help you notice where you might have a rounding problem, because you sometimes have a case which can be very annoying where traditional rounding errors won't have these add up correctly. Might be off by 1. And so when you can see the decimals, you can figure out where that discrepancy is and where you might shift. So for example, in this race of the 16 to 20 population, if my count, just using traditional rounding rules where everything under 5 goes down and everything over 5 goes up, if I had 1 over, looking at this data, I might take this Asian American population of 517.6 and drop that to 517 instead of 518, which traditional rounding rules would require to make this equal whole numbers. ECHO, as well as federal reporting, will kind of scream at you if you're off by 1 number. So I hate to belabor this, but those decimals. We don't include them, but they're important for making sure that your numbers will end up adding up right. So at that point, we've got all of our numbers. We could add additional counties if we needed to at that time. Then we'll go into ECHO. We're going to select progress data. I always thought that was process data, but in the environmental screen, it shows progress data. And we're going to start entering this data. So we're going to start with that full population of 16 to 20-year-olds, which we calculated in the first line, taking just a portion of each census group. We're going to specify the counts are not exact. Then we're going to list the gender. When you first enter male gender, these are going to be red. They will not turn black until you enter the second gender, in this case female, because these are making sure they won't turn red until your total by each population group enters this overall total of, in this case, 25,390. So same thing with age. Since this is targeting underage alcohol use, they're all in these youngest set of age groups. My apologies for not addressing this at the beginning. When you first come to this screen and you open the master total reach, you won't be able to enter it until you hit edit. So you will want to hit edit to enter the data and then save it when you're done. And you can see there's similar screens which you're well acquainted with for Hispanic, Latino, and then American Indian or Alaska Native, or race, sorry. Any numbers, you guys are probably well aware of this if you're using ECHO for anything, but if your counts are not equal, the numbers for each group will be red. With a population-based estimator, it very well might be a rounding error, so you'll just want to just check if it's one off, and if it is one off, and to figure out who's closest to the line of rounding a different way, and probably select that case. Questions? Okay. So I'm going to minimize my PowerPoint, and I've got things queued up to actually walk through this. I'd like everybody to go ahead and do this with me. So if you could go to the TTA Center, I'm going to go ahead and put this in the chat box so you guys can click on this link. Oops, I didn't get the first part of it. So if you guys can, that didn't copyright. Oh, I'm going to do that again, sorry. So if you guys can open up that to get a population-based reach tool. Maybe give me a couple thumbs up to let me know when you're there. Okay. Once you do that, then again here the population-based reach tool is right at the top currently. I imagine it might move over time, but it should be within ECHO. So click on that, and you can download that. I'm going to go to this one I already have open. You can see on the first page our instructions, and it has the link again to the Census Fact Finder page. So if everybody could also click on that.
Has everybody been able to see the link? If you can't see the link, you can simply go to the NC Prevention TTA website and click on Help Desk in the upper right-hand corner. That will bring up a screen that has a green center box, and click on Echo, and you will see on the Echo screen for the Help Desk a population-based strategy reach tool.
Thank you, Jamie. So is there anybody who doesn't have the reach tool?
Misty's asking, can Melinda walk back through those steps since we have the link now to kind of,
okay.
Yeah, do a visual demonstration of stuff.
Okay, so the link I provided for within the TTA Center brings you to the Echo help pages, and you can see one of the first things there is the counting reach tool. So go ahead and click on that, which will provide the instructions as well as the download at the bottom of the page. Do people have the population-based reach estimator open? Okay. Does anybody not have the population-based reach estimator open? Okay. Once you have the population-based reach estimator, you'll see in purple lettering the web address for the census, and so that's the first place we're going to go. So go ahead and click on that. Sometimes, for reasons I'm not sure why, it doesn't populate right to this page that shows the United States population. As it didn't for me, it populates here. If you get this page, instead of the one that looks like the first page in the webinar, click on Community Facts, and it will change to that page similar to what we had. Jamie, I can't see the chat box, so I'm going to ask you to interject if I end up going too quickly, okay?
Sure. Feel free to add stuff in the Q&A box, folks, the question box.
So is everybody at the fact finder and have a place where they can enter the state, the county, the city, the town, or the zip code? Anybody have a location they want me to enter? Okay.
Kyle says Cumberland County. So.
Okay, sure. We'll enter Cumberland County. Cumberland County, North Carolina. Once you get far enough along in the name, you'll see in the at the Census Fact Finder, it starts to populate locations. So Cumberland County, North Carolina. Notice right now This shows that there's 308 million people. This is the whole U.S. population. And once I hit go, it's going to change to Cumberland County, which is a small fraction of that population at 319,431. Everybody have that number showing up? You could put in your own county. It might end up being easier to see, to have the consistency of the same county. But I think walking through it will help either way. So 319,000 people, this population narrowed considerably. You should know if you've got more than 1 million people, unless you're in one of our metropolitan counties, that the number should be smaller once you've selected the community. Unless we have to get down to the census level, which we highly recommend that you just connect with Wake Forest School of Medicine if you need to get to a census tract level instead of a county or a city. We prefer to use the American Community Survey because it has the demographic breakdowns that the block grant requires, and it's newer than the census. So at this point, the 2010 census is pretty old, so we should only use it if we have to get down to a level that we can't get to with the American Community Survey. So I want everybody now to go ahead and click on the American Community Survey. You should, when you do so, you should end up seeing what basically looks like an Excel sheet of pluses and minuses, or an ordinary table. Fortunately, there is a little bit of shading to help you line things up. First, you want to make sure it's really capturing your area just as a confirmation process. So this one says Cumberland County as we originally entered. You can see in the order, first it talks about the sex and age of the population. Then it looks at the race of the population. It has a lot more breakdowns than what we need to have for block grant. Again, if your community has a significant population of one of these subgroups, you might be interested in knowing more about it. But for block grant reporting, it is not necessarily to get these smaller categories. Then we look at ethnicity. Then there's a few other things that we don't need, but that might be of interest to your community and your assessment and community diagnosis. So if we go over to, so we have this data all in front of us right now, and it lists the raw numbers, which is what we're going to use, as well as the percentage of the population. If we go to the retail alcohol access, when we open that up, can everybody see, is this print big enough, or do I need to try to make it a little bigger for you? Looks a little small to me. Okay. So first, we want to go ahead and just double check and take the county name. And so I'm going to put this in the second square. It's possible we do have the block grant conversion numbers locked. When I first came to this, setting this up for the PowerPoint, my worksheet was protected. If you can't type into your screen, if you go to review, and it should say on protect. Mine says protect right now because I've actually unprotected it. But if you can't type, you need to go to review, and under that you'll see this grid, and there'll be one that says on protect. So you'll want to click on that if you can't type in the green boxes. And the green boxes are the only places you should type, everything else has formulas. So you don't want to type in anything that has a formula. So only type in the green boxes. You shouldn't be able to type in the places with that don't, but just as a guideline, stay in the green boxes. And the first thing we're going to do is we're going to find out how much of this population we should be capturing, and that's what we're going to do by looking at taking the census totals. We're going to look over here by the population-based reach estimators. We're supposed to capture the 15 to 19-year-olds and the 20 to 24-year-olds. So Cumberland County has 22,178 15 to 19-year-olds, so I'm going to type that in. And they have a lot more 20 to 24-year-olds, 31,318. And I just want to double check those numbers because it's easy to get off the line in this setup. So I've got 22,178 15 to 19-year-olds, which is indeed what I typed. And then for 20 to 24-year-olds, I've got 31,318, which is again what I typed. When we actually get to the point where we're ready to look at all of these numbers and how they translate, our population for Cumberland County, population impacted for retail alcohol access strategies is going to be 24,006 individuals. So we'll just work our way down. There is a little bit of back and forth, so I apologize. And we, again, don't need everything. So if you guys remember from the lines, we do need 2 or more races, which in this case is 18,751. So we're going to write this down here. And you might find it's easier to print off the census information and highlight what you need. That might, some people like to just work from the right on screen and just double check, and other people might find it easier to print and highlight and then copy. These cells are hard. It's hard to actually copy from them, so you'll probably find it's easier to just end up typing. 2 or more races is actually in 2 places. It's at the top, and then it's also near the bottom. But as you can see, the numbers are the same in both places. So then we're going to just look at the single race categories, the broad categories. So the white population, we'll go down. Native American, Alaska Native. Oops, sorry, I'm not, there it is. 4,738. Yeah.
We have a question too from Misty. How do we know which categories we need to pull each one from?
I do have those highlighted. Well, wait, can we say a little bit more about that question?
Sure. Misty, let me activate your audio. That way we can make sure we answer your question. Hold on one second. Okay, Misty, can you hear us? You can probably say something now.
Yes, can you hear me?
Yes, ma'am. Thank you. Yeah.
Okay. So my question basically is, we're looking at retail access to alcohol, and we're going through the different categories, which I totally understand the age, but how would I have known that I did not need to enter all the races? Is there a cheat sheet that shows like what categories I need to grab out of the census for the alcohol, the tobacco, the prescribing, and the RX storage?
Yeah. So what we've tried to do is we've tried to keep the names the same, but I'm realizing that we need to make a slight adjustment because not all of these names are populating, but we generally we're only getting the broad categories. We're not getting any of the subcategories, so we're looking for the ones that are included in block grant reporting. But I'm going to make a note because I see a couple of these are not listed exactly the same as we intended, and I think as I'm talking through, I think they're listed exactly the same as the block grant categories, but I'm going to modify these so they list exactly the same as the census. So you don't have to remember that more than one race is two or more races on the American Community Survey. Would that be helpful?
I guess I've never seen the categories in the actual block grant report. So if I could get a list of those categories, then I would know what I need to enter into ECHO. Because like right now, if it were me, I would be going in there and I would be pulling the Native American, the Asian American, African American, white, more than one race. Like I would be filling in every single one of those blocks versus skipping down to just one or more than one race.
You do need to fill in all of those blocks. And the reason I skipped down is because they're presented in they're in a little different order, which, again, I'm going to switch this unless people have a big objection because this is the block grant reporting order, but it's not the census order. So I'm going to revise this to the census order unless people would not like me to do that. I think that would probably be helpful. So then you can just go down in order. There's still going to be things that you skip. So if we kept it in that order, we would start with the two or more races category at the top to be in the same order as the American Community Survey. Then the next category would be white, then the Black or African American, and so forth. Would that help?
Yeah, I mean, as long as we know what data we need to fill in,
yes,
that would be helpful.
Yeah, every line that is in the tool that's in green needs to be filled in for that column.
Okay.
They're just in a little different order, and so that's why I was kind of moving around differently. But I do think it would probably be helpful to make the order the same on the place where you enter it, put it in the census order, and then on the place where you pull out your block grant data, put it in the block grant reporting order, because they are not the same.
Okay, I think I just got confused when you skipped all of those categories, and I thought that you had mentioned just to fill in more than one race. So I just got confused. Sorry about that.
Yeah, no, that's okay. I think it's a valid question. As I'm looking at it, I'm realizing that we did purposely set it up to be in the same order as the block grant reporting, but there's no reason we can't make the census part of it in the census order and the block grant reporting part of it in the block grant order. So we don't have to have the same order in the top half as the bottom half, and I think that would probably alleviate confusion for many people. Because you're probably not the only one wondering why I was skipping around. Okay, so
Melinda, Maceo, I think has a question too. Maceo, I gave you audio, so can you hear us?
Can you hear me?
Yes, I can hear you, Maceo.
Yes,
oh, no, it was answered a while ago when I asked. It was answered.
Okay.
Yeah.
Okay. And I'm looking at this and I can tell. Oh, go ahead, Jamie.
Yeah. Thanks, Missy and Maceo. Keep the questions coming, and I'll keep monitoring. Just raise your hand if needed.
And I'm noticing my totals are not right here, so I know I have a data entry error. So I'm looking to see where it's at. Does anybody see my data entry error? Here it is. Wait. Oh, I still have something. I hate to display my poor typing skills here, but apparently I'm practicing that. Okay, now my totals match. So where I'm looking at that is I'm looking at the total for the race here in the population-based reach estimator, as well as the total population in the community survey on the very top line of data. So I know my totals are right because of that. Then we scroll down, we do the same thing for Hispanic and Latino, and again, within Hispanic and Latino and not Hispanic and Latino, there's lots of subcategories. We are not required to report those. If you had a significant Hispanic population, you might want to know more about those, but for block grant reporting, they're not required. So I'm typing in the numbers here for Cumberland County for ethnicity and comparing my total to the total for race, and they are the same. Fortunately, I typed well. Then the sex is at the very top again. So typing in the male population and the female population. And those numbers, again, should be the same. So we've got all of our data. We know we don't have a data entry error because we've checked all these populations against each other, and they do match. Then we actually go down to the block grant reporting criteria, counting criteria. And you remember when we first started doing this, we said we were going to be looking for a total population for block grant reporting as 24,006 people, and that is indeed the number that we're getting for population by age, population by race, population by ethnicity, as well as gender. So these are the numbers that you're going to end up entering in Echo. And I do have things set up so that we can look in Echo. Do we need to go through Echo, or I think everybody on the phone has entered demographics in Echo, but we can certainly do that if we need to, or address other questions. I'm going to go ahead and do it since I'm not hearing any feedback, just in case. I am just looking for a test developer case, and I'm looking for an environmental intervention because this tool is going to be used for environmental interventions because that's where we count the impacted population. We're going to go to the process or progress data bar. We're going to fill out the master total reach. To open it up, we're going to hit edit. Our total number of participants are going to be 24,006. Our counts are not exact. And then you can see my numbers are starting to be red. I've got 11,733 males, and rounding wise, the females are going to be 12,273, and you can see the red disappeared. When I go down to age, these categories are not correct, so this is showing up as inaccurate. So the 15 to 17-year-olds, we've got 8,071 of them. This math rounding is working out really well for this population. It'd be nice if we had one that didn't work. 15135. So race worked. Our ethnicity count is going to be 26167 and 21389. Oops, something I typed wrong. 26 1. Wait, what? I typed an extra digit. Oops. Uh-oh. I hope that's not a bad omen of me saying I'm not connected to the internet for a second. So you can see these are all working out. Let's see, is our race going to work out? Let's see. Well, I'll type this in with traditional rounding numbers and see if it works. Okay, so something is off. How much are we off by? I'm off. Looks like I entered something wrong. 349, 578, 8848, 56, 1, 2251, 1382. Oops. 543. Excuse my bad typing. So I'm still off by 1. You can see I've got 1 too many cases in here. So I'm going to look for something that would have usually rounded up. And in this case, so what would have usually rounded up is the Asian American population, the African American population, the Native Hawaiian, and the other category. And so either the Asian American and the African Americans both were closest to not rounding, so I'm just going to randomly pick one of those to drop down a notch. And there's really no rule for which one you should pick in this case, where it would really be the same one. Just pick I'm just going to pick the Asian population since that's smaller. I'm seeing a notice saying my organizer is having technological difficulties. I don't know what's going on. I'm going to go ahead and close this out and hope we're doing okay. So that's all
Melinda,
to do. Yes.
Can you hear me? Yeah, I'm still connected to the audio.
Okay.
We lost electricity just now, so it should run fine by itself. And
okay.
Amanda and Alex are in the background too, so I'm going to reach out to them. But you should be fine in the background, and I still have audio connection. I just don't have computer connection anymore because I'm sitting in the dark.
Okay. So Jamie has lost his power, unfortunately. Hopefully that resumes soon. But this is the end. So we did have one case where we had to kind of adjust for rounding, and you very well might find that. But otherwise, you just enter exactly what's in the population-based reach estimator into these cells, and you, of course, save this in. I am going to enlarge my chat box in case there's questions so that I can see them. Is there anything else that people want me to walk back through or other questions that have arisen? I'm not seeing any questions. I'm going to go ahead and hold on in case you're forming any in your mind. This is something, if you want help doing it, you are welcome to contact me and I can help. We can put up a webinar and we can walk through actually doing a little bit of your data where you're able to answer those questions individually. We do welcome additional suggestions, so feel free to share those. As I shared based upon Missy's question, I am going to go ahead and make some adjustments to the census data to make it appear in the same order as it comes out in the American Community Survey. So you'll know you just go down in order. I think that will help clarify. It will not change anything with the block grant reporting categories down at the bottom of the screen in blue. Again, these are categories. You shouldn't touch these because these have a lot of formulas in them to bring out the population, proportion of each population, depending upon what we're looking at. So I'll make that adjustment to the ordering by the end of the week. Are there other things that would be helpful? Other questions? And I think Jamie is still without power.
Yeah, I'm still with you. Can you hear me?
I can hear you, yes.
Great, yeah. I'm actually looking in on my phone. That still works.
Oh, okay.
And the webinar was not it was not impacted in terms of otherwise. And the folks in Winston-Salem have control rights, and the video is still recording, so we're still good.
Okay. I do not see any additional questions in the open chat box. I don't know if you see anything in your moderator chat box.
Nope, I don't see anything on my end.
We don't see anything here, Jamie.
Thank you all. So again, I'll stay on a few more minutes in the event that there are questions you're forming, and we are certainly available for additional questions as well as a little hands-on assistance with your data.
Yeah. Melinda, a few housekeeping items. About 60 minutes after the email of the webinar ends, everybody will receive an email that has the evaluation survey link. It also has a link to the help desk article that includes the handouts for today, and will include a video recording of today's webinar. After we have a chance to edit that and upload it, it may take a while, especially with my current lack of electricity. But the handouts are already out there on the help desk. So about 60 minutes afterwards, you should receive that email. Plus, inside of that email is something a little bit different. You will receive a certificate inside that email. that's automatically generated. Now, for this particular call, since it was a TA call, we can't necessarily award certification credit for that, but the system is automatically generating certificates of attendance. That's really generic in nature. So if you want to keep up with those, feel free. If not, not a big issue. It's a simple attendance item, but we did not award credit for this particular event because of the topic. And I think that's all my things on my end. I don't see any other questions yet.
Okay. Thank you, Jamie. And I'm just going to put out there again, just in case, that we are available for follow-up hands-on assistance with your data if needed. And I will make those ordering shifts to make it a little bit easier to see where to go from the outset.
Okay, great. Well, again, we appreciate everybody's participation. Let us know if we can help. We've had a few calls about the Reach tool, but not as many as I expected. So if you have questions, please let us know. We'll be happy to help or refer those to Melinda. And we hope to have really specific individual support calls like this more frequently as we move forward to help folks out.
And I encourage you, if you're doing population-based work, to not wait until your reports are due to kind of test it out. I think once you do it one time, you'll have that data. It doesn't change very often, but it will be easier. And so it'd be good to, and since it doesn't change, it doesn't hurt to do it early. So if you know you're going to be doing a significant multi-county effort, for example, there's no reason why you couldn't do this ahead of time and cross it off your to-do list.
Okay. Well, thank you so much, Melinda, for taking time to help us with this process. And
thank you for inviting me.
Yep. In about 60 minutes, everybody should receive an email, and your handouts will be inside the email. Thanks so much. And this concludes today's webinar. Thanks, Melinda.
Thank you.